Well, I guess what I'm looking for in terms of, I want to look, first of all, I'm thinking about the client and their comfort. I'm thinking about longevity and durability and predictability for the dental part of it that I'm going to deliver to them, because our philosophy is we don't want to redo stuff. We kind of like to get together, find a plan, work it out, and do very little repair work after that for the patient, provided they'll do their end by taking care of themselves. And those are the kind of people we're looking for. Well, I think first of all it's really important for a patient or a client to begin to think about their dental future and what's their preference. Do they want one that's got some kind of longevity to it, something that makes sense where each dollar that's spent is enhancing their investment, or do they want to go from one crisis to the next? So I think the kind of person that we really have the most fun with is the person that says, you know, I want to make a plan. It's just like building a house. If we're going to build a house, we don't want to start sticking sticks in the air until we've done a site plan. We've gone and developed, you know, made sure our lot's solid and everything, no sinkholes or anything like that, so that each step of the way then builds on the other rather than having to go backwards. There's nothing that discourages a patient, in my view, over 40 years of practice, than to find out they did something that was a short-term fix, but it didn't fit long-term, and they wind up redoing it. That's when a patient starts feeling like their mouth is a money pit, because they're redoing stuff. Where if there would have just been someone to help coach them in the beginning about, let's look at this from an overall picture, an overall perspective, and make sure that each step of the way makes sense on what we want to build together, so that we don't wind up backing up and redoing it. I have a lot of patients coming here that are discouraged about their past dental history, and they begin to think in the point where I'm going to ultimately lose my teeth, and so why should I invest in my mouth anymore? And I don't blame them for that, because someone didn't say, hey, wait a sec, let's just back up here and let's get a real good thorough look at everything that's going on so that you understand completely what's going on, because they are your teeth. They're not my teeth, they're your teeth. I think that's a big difference in the profession. Is most dentists kind of look at it like they're their teeth. They belong to you as a client. They're your teeth. So I want to help you make sure that each step of the way makes sense to you in what you're doing and your investment that you make. Well, for instance, the best dentistry is no dentistry. As early as we can intervene with a young person, for instance, with interceptive orthodontics that would help set their bite up so they don't break teeth later on, that's the cheapest way to go. And help the parents understand how to help a child take care of their teeth, put on a fluoride if that's necessary, or dietary instruction that will help break the cycle of disease, help the child understand what it takes to manage the disease in their mouth and not have any decay, and have a perfect bite from good orthodontics if that's necessary. That's pretty cheap, I think, in my view. What's discouraging is when an adult gets down that road so far that backing up, then it's like you got to stop the bus somewhere or it's going to fall off a cliff. And so what are we going to do? And I'm trying to get patients' attention earlier when we talk about signs and symptoms. Signs are a lot easier to identify from my viewpoint, but they may not be obvious to the patient. Our challenge then is to help the patient understand what a sign is until they get preventing them from getting a symptom, which means, oh, I got a toothache. That's the obvious thing. Person thinks about a toothache, pain, swelling, bleeding. That's the typical thing that's associated with dentistry. What we're trying to do is help the patient understand the subtle little things that are pointing to bigger problems later. So then we can want to prevent a money pit mouth. The earlier we can intercept that cycle, the better. Then each dollar that the patient does invest, it adds to the one that's before, and so that they get a return on their investment to the point where they have very little incidence. I have many patients in this practice. They have very little incidence of needing me anymore. We see them on a maintenance basis every 3 to 6 months. They don't need me for much anymore. They're taking good care of their investment. It's coming back a wonderful 10, 20-fold return for them, because they're not experiencing a lot more dental disease.